Hello class, welcome to Emergency Medical Responder, Chapter 10, Medical Emergencies. In the next few slides, I'll be talking about the competencies in terms of expectations for emergency medical responders in terms of medical emergencies. When it comes to medicine and being an EMR, it is important that as an EMR, you have the ability to recognize and manage life threats based on assessment findings of a patient with a medical emergency while awaiting additional emergency response. In terms of being an EMR, when it comes to medical overview, that is your assessment and management of a medical complaint. This is on pages 203 and 204 of your text. And we'll be talking about neurology, the anatomy, presentation, and management level of decreased levels of responsiveness, which is on page 204 in your text, seizure, which is covered on pages 204 through 206 of your text, and stroke, which is covered on pages 210 through 211 in your text. We will also be looking at abdominal and gastrointestinal or GI disorders, and specifically the anatomy, presentations, and management of shock that can be associated with abdominal emergencies, such as gastrointestinal bleeding. This is covered in pages 214 and 215 of your book. And we'll look at endocrine disorders in terms of the awareness of diabetic emergencies that can cause altered mental status. That is on pages 213 and 214 of your text. Naturally, we'll be talking about cardiovascular incidents, and we'll look at anatomy, signs, symptoms, and management of chest pain and cardiac arrest. And these are covered on pages 207 through 209 of your book. We'll also be looking at the medical management of respiratory emergencies and looking at the anatomy, signs, and symptoms and management of respiratory emergencies, including those that affect the upper airway, which we talked about in Chapter 7, Airway Management, and the lower airway, which is covered in pages 209 and 210 in this chapter of your text. We will talk also about genitourinary and renal issues and blood pressure assessment in hemodialysis patients. And of course, I'll explain a little more about that. And that is covered in page 215 of your text. When it comes to medical emergencies, there are many common medical conditions that you will encounter that include angina or angina pectoris, heart attack, congestive heart failure, dyspnea, asthma, stroke, hypoglycemia, diabetic coma, and abdominal pain. Treating patients with these medical conditions or any medical condition can be very challenging, but EMRs can prepare to treat these medical patients by studying the signs, symptoms, and treatments of each condition. If you recall in Chapter 9, we talked about patient assessment in medical emergencies, and just to remind you of the steps and the order in which they are to be taken. You have your scene size up first, then your primary assessment, then history taking, then your secondary assessment, and reassessment. When it comes to patient assessment in medical emergencies, you want to make sure you review your dispatch information to help you decide which problems are likely. This also helps you to pre-plan which set of gear you're going to retrieve from your unit. You want to make sure you carefully assess the scene to identify pertinent safety issues for you and your patient. And remember that I mentioned that you and your team's safety are always the #1 priority. As you perform your primary assessment, first try to form an impression of the patient's problem, then determine the patient's responsiveness, introduce yourself, check the patient's ABCs, that's airway, breathing, and circulation, and acknowledge the patient's chief complaint. Typically, it is best to obtain a medical history on a patient experiencing a medical problem before you perform a secondary patient assessment. And you want to do that following the sample history format. And just to remind you of the letters in that acronym, S stands for signs and symptoms, A stands for allergies, M stands for medications. That includes over-the-counter and herbal supplements and vitamins. P stands for pertinent past medical history. L is the last oral intake of food or fluids. And E stands for events associated with or leading to the illness or injury that you're there to respond to. Obtain the patient's vital signs and perform an ongoing reassessment or patient monitoring if the arrival of emergency medical services personnel is delayed. Make sure to remember to reassure and help calm the patient. General medical conditions may have many different causes, but can result in similar signs and symptoms. So you need to learn to recognize the signs and symptoms as well as providing the general treatment and following those guidelines so you can provide immediate care. The initial treatment can stabilize the patient until other EMS and hospital personnel can take over. In terms of measuring a patient's mental status or an altered mental status, I need to remind you of the AVPU acronym, AVPU. And when it comes to mental status, it can be a sudden or a gradual decrease in a patient's level of responsiveness. So A stands for awake and alert, meaning that the patient is alert and can answer simple questions accurately and appropriately. In other words, they know who they are, where they are, and what day it is. V means the person is responsive to verbal stimuli and or will react to loud noises. So they may not be able to be fully alert and know exactly where they are, etc., but they are responsive to verbal stimuli. And I had also mentioned to remember that someone with an altered mental status who's partially conscious cannot hear very well. So you want to make sure that you speak loudly to them, or maybe snap your fingers next to their ear or clap your hands to see if you get the V, which is responsiveness to verbal stimuli. P stands for responsiveness to pain. This is a patient who is responsive to painful stimuli, either by pinching their ear or the skin next to their collarbone. And their responsiveness will usually be that they move or cry out in response to painful stimuli. The U stands for unresponsive. This is an unresponsive patient who will not respond either to verbal or painful stimuli. So they're completely unconscious. So when assessing the patient's mental status, consider two factors: the patient's initial level of consciousness and then any change in that level of consciousness. There are many different conditions that may cause an altered level of consciousness, including head injury, shock, decreased level of oxygen to the brain, stroke, a slow heart rate, or high fever. And that's not an exclusive list. It's just a common set of findings. But as I mentioned, there are a lot of things that can cause an altered level of consciousness, but these are very common ones. And these are some other conditions that can cause an altered mental status. An infection, poisoning, including drugs and alcohol, a low level of blood glucose or blood sugar, like you would find in diabetic emergencies, an insulin reaction, or a psychiatric condition. Even if you cannot determine what is causing the patient's altered level of consciousness, you can help by treating the symptoms of their problem. Seizures are caused by sudden episodes of uncontrolled electrical impulses in the brain. Generalized seizures produce shaking movements and involve the entire body. These seizures usually last 1 to 2 minutes, although prolonged seizures may continue more than 2 minutes. Patients are usually unconscious during generalized seizures and do not remember them afterwards, and they may remain unconscious for a brief time after the seizure is over, so be aware of that. Although seizures are rarely life-threatening, they are a serious medical emergency and may be a sign of a life-threatening condition. One cause of generalized seizures is a sudden high fever. These seizures are called febrile seizures. They occur most commonly in infants and young children. Some seizures result in only a brief lapse of consciousness. These seizures are called absence seizures. Patients may blink their eyes, stare vacantly, or jerk one part of their body. You must monitor the patient's ABCs and arrange for transport to an appropriate medical facility right away. Seizures can be caused by many factors, including epilepsy, trauma, head injury, stroke, or shock. During a seizure, there also can be a decreased level of oxygen to the brain, and the seizure itself may be brought on by a decreased level of oxygen to the brain. Other causes for seizures include high fever, infection, poisoning, an overdose of drugs or alcohol, a brain tumor or an infection, diabetic emergencies, such as one produced by low blood glucose, or seizures can be a complication of pregnancy. And then there are unknown causes. Sometimes people have a seizure and after tests and studies, there is no medical reason that is found for someone to have had a seizure, but it can happen. Usually, by the time you arrive on scene, a seizure will be over. However, if it has not ended, your treatment needs to focus on protecting the patient from injury. The patient should be moved only if he or she is in a dangerous location. And you cannot do anything about the patient's airway during the seizure. And I want to clear up a common misconception. It used to be thought that people would swallow their tongue. That's physiologically impossible because of the way it's connected inside the lower jaw. However, what happens is the spasmodic muscle movements and the tongue is a very large muscle, it can cause the constriction of muscles in the neck and also the constriction of the tongue, and that can press up into the roof of the mouth and compromise the airway. Once a seizure is stopped, it is essential that you ensure that they have an open airway once that seizure is over. This is usually best accomplished using a head tilt chin lift maneuver. After you've opened the airway, make sure to place the patient in a recovery position. I mentioned that sometimes they remain unconscious for a period of time, and they are susceptible to vomiting because of all the spasmodic muscle movements, etc. and sometimes their swallowing reflex has been compromised during the seizure, so they may have a lot of saliva that has built up in their mouth. So you want to make sure you place them in the recovery position so that anything that comes up or is already in their mouth can drain out properly. If the patient does not resume breathing after a seizure, or if the seizure is prolonged, make sure you begin mouth-to-mask, mouth-to-barrier, or bag mask device rescue breathing. Administer supplemental oxygen as soon as it is available. After the seizure, move the patient to a more comfortable private place if other EMS personnel are delayed. And you want to make sure that nothing has happened that could involve a possible cervical or spinal damage, but before you move them. Now let's talk about some specific medical conditions. You will find it helpful to be knowledgeable about some of the more specific medical conditions you may encounter as an EMR. This information will help you assess, treat, and communicate more effectively with patients who have medical conditions. When it comes to heart conditions, the heart must receive a constant supply of oxygen or it will die. The heart receives its oxygen through a complex system of coronary arteries or heart arteries. These are the arteries that lie on the outside of the heart and feed the sections of the heart the oxygen supply that muscle needs to work. Coronary arteries may narrow as a result of a condition called atherosclerosis. This disease process causes layers of fat to coat the inner walls of the arteries. Progressive atherosclerosis can cause a condition called angina or angina pectoris, which is another way of saying chronic chest pain. It can also cause heart attack and cardiac arrest. Angina pectoris or angina pectoris is chest pain caused by inadequate flow of oxygen and blood to the heart muscle. Angina is often described as heavy pressure or a heavy discomfort. Angina attacks are usually brought on by exertion, emotion, or sometimes even eating. A crushing pain may be felt in the chest and may radiate to either or both arms, the neck, jaw, or any combination of these sites. The patient is often short of breath and sweating, is extremely frightened, and can have a sense of doom. You need to ask the patient whether they've already been diagnosed of a heart condition or being treated for a heart condition in terms of angina, and whether or not they have been prescribed nitroglycerin. Nitroglycerin usually relieves angina pain because it helps relax the coronary arteries that have the plaque built up in them, and that takes away some of the pain and pressure. If the patient has been prescribed nitroglycerin, you can assist the patient in taking one pill or administering aerosol spray if that's the way that nitroglycerin has been prescribed to them. And by assist, I mean you can hand them the bottle of medicine or spray, but you cannot actually give them the medication yourself. If the pain has not lessened 5 minutes after the first dose, help the patient take another. If the pain has still not lessened in 5 minutes after the second dose, you need to assume the patient is having a heart attack and transport them immediately. Always follow local protocols regarding the administration of nitroglycerin. Now let's talk about heart attack. A heart attack, also known as, of course, myocardial infarction, results when one or more of the coronary arteries is completely blocked. The primary causes of coronary artery blockage are severe atherosclerosis or a blood clot from somewhere else in the circulatory system that breaks free and becomes lodged in one of the coronary arteries. There's an excellent diagram on this slide, and you can see these coronary arteries that lie on the outside of the heart, and you can also see where there's some plaque built up in the coronary artery. Signs of a heart attack include the patient suffering immediate and severe pain. The pain may radiate from the chest to the left arm or to the jaw or the back. The patient is usually short of breath, weak, sweating, and it's profuse sweating, and nauseated and may vomit. If the blocked area is critical or large, the heart may stop completely. Complete cessation of the heartbeat is called cardiac arrest. And we talked in an earlier chapter about cardiac arrest can be caused by many problems up to and including a heart attack. In this case, we're focusing on heart attacks specifically. And if the heart has ceased to beat, they are now in cardiac arrest. Cardiopulmonary resuscitation, or CPR, is the first emergency treatment for cardiac arrest. Take the following actions. First, summon additional help immediately. And if the patient is conscious, if they have not suffered full cardiac arrest, you need to talk to the patient calmly to help relieve his or her anxiety, and they will have a lot of it. And you can touch a patient gently to establish a bond. Just gently on their shoulder, or place your hand gently on their arm when you talk to them, and it helps calm them down and reassure them that you are there to help. As we mentioned, that sometimes they have a feeling of a sense of doom, and that's not strictly associated with angina. It also can occur if they're in the process of having a heart attack. Move the patient as little as possible and do not allow the person to move. They don't need to place any exertion on their heart. So help place the patient in the most comfortable position for them, which is usually a semi-reclining or a sitting position. This helps them breathe a little bit more easily. Help the patient take 1 adult aspirin, which is 325 milligrams, or 2 to 4 low-dose aspirins of 81 milligrams of strength each. Administer oxygen if it is available and protocols permit. Be prepared to administer cardiopulmonary resuscitation if necessary. If an automated external defibrillator or an AED is available, have it brought to the patient and make sure it is standing by and ready for use if needed. Your primary role is to provide emotional support and arrange for prompt transport to an appropriate medical facility. We're going to talk now about congestive heart failure. Congestive heart failure is caused by failure of a heart to pump adequately. If one side of the heart becomes weak and cannot pump as well as the other side, the circulatory system becomes unbalanced, resulting in circulatory congestion. In CHF, or congestive heart failure, the failure is in the heart muscle itself, but the congestion is in the blood vessels. In the figure here on this slide, you see where a normal exchange of oxygen and carbon dioxide between the capillaries and the alveoli. In pulmonary edema, congestive heart failure causes fluid to leak from the capillaries and build up in the alveoli, impeding oxygen and carbon dioxide exchange. So you see on the figure on the left, figure A shows normal opening between the capillary and alveoli. On the right side, you see that fluid that's built up in those vessels. Or it leaks from the vessels, from the capillaries into the alveoli. The signs and symptoms of CHF are shortness of breath, which is a major symptom, rapid, shallow breathing, moist or gurgling respirations, and profuse sweating, along with enlarged neck veins, swollen ankles, and a high level of anxiety. As soon as you determine the patient is experiencing CHF, take these actions. Place the patient in a sitting position with the legs down to drain some of the fluid back into the lower parts of the body. Administer oxygen at a high flow rate based on your local protocols if you are trained to use it. Summon additional help right away and arrange for prompt transport to an appropriate medical facility. Earlier, you heard me mention dyspnea. Dyspnea means shortness of breath or difficulty breathing. It is usually associated with serious heart or lung disease. Heart-related causes include angina pectoris, heart attack, and CHF. Pulmonary diseases such as chronic obstructive pulmonary disease or COPD, emphysema, chronic bronchitis, pneumonia, and asthma can all cause dyspnea. COPD and emphysema are caused by damage to the small air sacs or the alveoli in the lungs. Chronic bronchitis is caused by an inflammation of the airways in the lungs. Pneumonia is caused by an infection in the lungs. Asthma is caused by clamping down or spasms of the smaller air passages. Do not spend too much time trying to determine the specific cause of a patient's dyspnea, but rather focus on treating the symptoms. With dyspnea, in terms of general treatment, you want to check the patient's airway to confirm it is not obstructed. Check the rate and depth of the patient's breathing and be prepared to assist with mouth-to-mask, mouth-to-barrier, or bag mask device rescue breathing. Place the patient in a comfortable position, provide reassurance, loosen any tight clothing, and administer oxygen if it is available and you're trained to do so. Asthma is an acute spasm of the smaller air passages associated with excess mucus production and swelling of the lining of the respiratory passages. Asthma can be caused by an allergic reaction, severe emotional distress, exercise, or respiratory infections. Asthma is a serious disease that killed 3,564 reported cases of people in the United States as late as 2017. Patients experiencing an asthma attack will have great difficulty exhaling through partially obstructed air passages. A wheezing sound will be heard on exhalation. Many patients will have taken medications before your arrival. They have and have lived with chronic asthma and are aware when they have the onset of symptoms and will have often taken their medication before you arrive. But just be aware that patients can die during asthma attacks. Follow the treatment steps for dyspnea and instruct the patient to perform pursed lip breathing. Pursed lip breathing relieves some of the internal lung pressures that cause asthma attacks. And you can read more about pursed lip breathing in your text. If advanced life support is not available, you need to arrange for prompt transport to an appropriate medical facility as soon as possible. Now we're going to move on to stroke. Strokes are a leading cause of brain injury and disability in adults. The CDC says approximately 795,000 adult stroke patients a year and 146,383 stroke deaths occurred in 2017. Most strokes occur when a blood clot blocks blood supply to a part of the brain, but it can also occur because of a blood vessel rupturing in the brain. The signs and symptoms vary depending on which portion of the brain is affected, and there can be anything from a headache to numbness or paralysis on one side of the body. And that is a very strong indicator of stroke. Strokes occur on one side of the body or the other. The patient will also struggle most likely with dizziness and confusion. Some of the signs and symptoms that will also occur with stroke are drooling, an inability to speak, difficulty seeing, unequal pupil size, unconsciousness, seizures, respiratory arrest, incontinence, and that can be bladder or bowel or both, and general unresponsiveness. The Cincinnati Pre-Hospital Stroke Scale is an easy-to-administer and accurate tool that you can use to determine whether a patient may have experienced a stroke. It requires no special equipment and consists of 3 assessments. The first is the assessment of facial muscles by having a patient smile. You will see a marked difference between one side and the other. You also need to assess arm drift by having the patient hold his or her arms in front of the body. If a side of the body has been affected by stroke, that arm will droop. They'll be unable to hold it or maintain its position up. Speech assessment is by having a patient repeat a simple phrase. If the patient cannot complete one or more of these tasks, you can suspect a stroke. This is Table 10-1 from your text, which is a nice consolidation of the Cincinnati Pre-Hospital Stroke Scale. This is another one of those things that you need to not only know but be fully competent with, because you will use it in the field. In terms of treatment with stroke, your first priority is to maintain an open airway. Administer oxygen using a non-rebreathing face mask if it is available and you are trained to use it. If the patient is having a seizure, try to prevent further injury from occurring. If they're in full body spasm, the contractions of those muscles can be so strong because they have a lot of adrenaline flowing that they can break their arm on a table leg or something like that. So you need to make sure that any potential articles that they could injure themselves against are away from them. And also you can fold a jacket or towel or anything and just gently place it underneath their head so they aren't banging their skull against the floor or the surface. Be prepared to administer rescue breathing if the patient stops breathing. Place an unresponsive patient in the recovery position to help maintain an open airway, and give emotional support by talking to and touching the patient, as I mentioned before. Some stroke patients can be treated with special drugs to dissolve blood clots in the brain or devices that go in through a blood vessel and help retrieve the clot. And of course, that's all done at the hospital level. So transport to an appropriate facility as quickly as possible is very important. You need to arrange for prompt transport that is equipped to treat stroke patients. Now let's move on to diabetes. Diabetes is caused by the body's inability to process and use glucose or sugar, which is carried by the bloodstream to the body's cells. The body's cells need both oxygen and glucose to survive. Those are their fuel sources. The body produces a hormone called insulin in the pancreas that helps the glucose carried by the blood to move into individual cells where it is used as fuel, as I mentioned. If the body does not produce enough insulin, the cells become starved for glucose and diabetes results. Many diabetics must take supplemental insulin injections. Diabetes is a very serious medical condition. 2 specific conditions can occur in conjunction with it: hypoglycemia and diabetic coma. Hypoglycemia occurs if the body has enough insulin but not enough blood glucose. An older term for hypoglycemia is insulin shock. The signs and symptoms include pale, moist, cool skin, rapid, weak pulse, dizziness or headache, confusion or unconsciousness, and heavy or profuse sweating. They can also have hunger, and there can be a rapid onset of these symptoms within minutes. Suspect low blood sugar if the patient has a history of diabetes or is wearing emergency medical information, such as a medical bracelet. Sometimes it's a pendant necklace. If a hypoglycemia is not diagnosed and corrected by rapid administration of glucose in some form, the patient may die. A person experiencing hypoglycemia may appear to be drunk. To try to get answers to the following questions. First and foremost, are you a diabetic? Did you take your insulin today? Have you eaten today? And when was the last time you ate? If a patient is able to swallow, get him or her to eat or drink something sweet, like orange juice, even soda, although that's more difficult because of the fizz. But orange juice is flat and contains a lot of sugar. If trained and authorized by medical control, oral glucose may also be used. The EMTs and paramedics will use a glucometer to actually measure the blood sugar level and manage accordingly. So you want to make sure that you've called for their help as soon as possible. Continuing with hypoglycemia, if a patient is unconscious, open the patient's airway and assist breathing and circulation. Do not administer fluids by mouth because the patient may choke and aspirate the fluid into the lungs. The patient must have glucose administered intravenously as soon as possible. So some EMRs do carry a tube of oral glucose gel or tablets that can be placed inside the patient's cheek. The gel is preferable because you can place it inside the cheek. They're not likely to choke on it. The tablets do dissolve very quickly, but there is the potential for it to slip or fall back into the airway. So glucose, I have found, is the most effective and safe treatment. Now we'll talk about diabetic coma. Diabetic coma occurs when the body has too much blood glucose and not enough insulin. The signs and symptoms of diabetic coma include a history of diabetes. Their skin will be warm and dry. It will have a rapid pulse, deep and rapid breathing, and a fruity odor on their patient's breath. They will also experience weakness, nausea, and vomiting, and increased hunger, thirst, and urination. And it can be a slow onset of symptoms, like a matter of days. Misdiagnosis of this condition is common because it's not always easy to distinguish between hypoglycemia and diabetic coma. But as I mentioned earlier, you want to administer a liquid substance that contains sugar. You can use something like apple juice. There are a lot of common things that are available that you can administer that have a high level of sugar. Now, this is Table 10-2 from your book, which compares hypoglycemia and diabetic coma and the differences between them. This table is extremely important, and you need to become familiar with hypoglycemia and diabetic coma signs and symptoms. Continuing with diabetic coma, as I mentioned, administer a liquid substance that contains sugar. In a patient who is experiencing insulin shock, the sugar may improve the patient's condition. If the patient is experiencing a diabetic coma, the sugar will not raise the blood glucose level enough to do any further harm. In general, give a conscious diabetic patient sugar by mouth and arrange for prompt transport to an appropriate medical facility. If a diabetic patient is unconscious, arrange for prompt transport, also in that case to an appropriate medical facility. Now we're going to talk about abdominal pain. The contents of the abdomen are divided into hollow and solid structures. Hollow structures are really tubes through which contents pass, whereas solid structures produce substances. The abdomen occupies a large part of the body, and abdominal pain is a common complaint. As an EMR, you need to recognize that a patient has an abdominal problem, but you're not expected to determine the cause of abdominal pain. It is a very complex series of solid and hollow organs, and there are many things that can cause abdominal pain. So your job is to really treat their symptoms and get them transported. And you're not trained to be a doctor, so don't try to diagnose their abdominal pain. An acute abdomen or acute abdominal pain is caused by an irritation of the abdominal wall. This irritation may be the result of infection or may be caused by the presence of blood in the abdominal cavity, and this pain can be referred to other parts of the body. The abdomen may feel as hard as a board. These patients may have nausea and vomiting, fever and diarrhea, as well as pain. Some patients with abdominal pain will vomit blood because they are bleeding from the esophagus or stomach. If they're bleeding from the lower part of the gastrointestinal tract, it may produce bloody stools that may contain bright red blood or stools that may be black and tarry. These patients must be treated for shock. If a patient has abdominal pain, you want to monitor their vital signs, treat the symptoms of shock, keep the patient comfortable, and arrange for transport to an appropriate medical facility. One cause of an acute abdomen is what is called a AAA, which is an abdominal aortic aneurysm. A AAA occurs when one or more layers of the aorta, which is a large vessel that runs all the way through the length of the abdominal cavity. If it becomes weakened, or it can separate from one layer, or two layers can separate from the other layers of the aorta, a AAA can occur. Patients who have diabetes, high blood pressure, or atherosclerosis, as well as heavy smokers, are at high risk for developing a AAA. The patient may complain of a tearing sensation in the abdomen and may have pain referred to their shoulder. If a AAA ruptures, the patient will experience severe pain and profound shock. They are in danger of imminent and very rapid onset of death. So if you recognize these symptoms, you have to call for acute care to respond as quickly as possible. The treatment for AAA is to place the patient in a comfortable position and treat for shock. If they don't have shock immediately, they are likely to develop it rapidly. Handle these patients very gently, and as I mentioned before, arrange for immediate transport to an appropriate medical facility. Now we'll talk about kidney dialysis patients. People with certain types of kidney disease are unable to filter waste products from their bloodstream. Many patients with chronic renal or kidney failure undergo a process called hemodialysis, or you may be more familiar with the term just dialysis, 2 or 3 times a week. The patient's blood passes through a machine that filters out waste products and returns cleansed blood to the patient. So the machine essentially is doing the job that the patient's kidneys cannot do. Most hemodialysis or dialysis patients have a shunt implanted in their arm or leg. A shunt is a surgically created connection between an artery and a vein. If the patient has a shunt, take his or her blood pressure in the arm without the shunt to avoid damaging that shunt. Patients who are being treated by dialysis may experience medical emergencies related to their dialysis treatment. The patient may experience a drop in blood pressure or BP because of the changes in their body from going through dialysis treatment. This decrease in BP can produce shock. Dialysis patients are also at risk for internal bleeding. Hemodialysis patients may also experience abnormal levels of electrolytes in their blood, and these imbalances can cause cardiac arrhythmias or dysrhythmias that sometimes can result in cardiac arrest. So you need to treat the symptoms that are presented to you by the patient. Now let's talk about infectious diseases and epidemics. You must understand a few principles about infectious diseases so you can help protect yourself, provide proper patient care, and help to prevent the spread of infectious diseases to other people. Infectious diseases can be spread from person to person by direct contact or indirect contact or contact with blood or body fluids. You need to review content that is previously covered in Chapter 2, which is Workplace Safety and Wellness. An epidemic is an infectious disease or condition that affects many people at the same time in the same geographic area. If an epidemic spreads to many different parts of the world at the same time, it is called a pandemic. EMRs are most familiar with the COVID-19 pandemic of 2020. Let's review some of the epidemics and pandemics that have occurred since 2000. This is a table 10-3 that's in your book and is a list of epidemics and pandemics that have occurred since 2000 to the time of this recording in 2021. You have SARS, Ebola, swine flu, MERS, and most lately COVID-19. So let's go through a summary of what we've covered in this chapter. General medical conditions may have different causes, yet can result in similar signs and symptoms. EMRs who are skilled at recognizing signs and symptoms of various general medical conditions and are knowledgeable about general treatment guidelines will be able to provide immediate care for patients even if they are not able to determine the exact cause of the problems. With a patient who has general medical complaints, follow the systematic patient assessment sequence. Usually it is best to collect a medical history using the sample format which we reviewed on patients experiencing a medical problem before you perform a physical examination. Continuing with our summary, we talked about AMS, or altered mental status, which is a sudden or gradual decrease in the level of responsiveness. When assessing AMS in a patient, use the AVPU or AVPU scale, which we reviewed in this chapter and a previous chapter. You should complete the patient assessment sequence to ensure scene safety and proper assessment, and also their initial treatment seeks to maintain the patient's ABCs, airway, breathing, and circulation, in normal body temperature, and to keep the patient from incurring any additional harm. If a patient is unconscious and has not sustained trauma, make sure to place that patient in a recovery position or use an airway adjunct to help maintain an open airway. We also talked about seizures, and these are caused by sudden episodes of uncontrolled electrical impulses in the brain. Usually the seizure will be over by the time you arrive, but if it has not ended, focus on protecting the patient from injury, and I talked about how to do that before. And do not try to restrain their movements. Don't try to pin down their arms and legs, because the resistance against you pinning them down can cause fractures. Once a seizure has stopped, ensure that the patient has an open airway. You can then place that patient in the recovery position and arrange for prompt transport to an appropriate medical facility. And to finish our summary, some specific medical conditions typically encountered by the EMR include angina or angina pectoris, heart attack, congestive heart failure, dyspnea, stroke, hypoglycemia, diabetic coma, abdominal pain, and infectious diseases. By learning the causes and knowing the signs and symptoms of these conditions, you may able, as an EMR, be able to provide more specific care for the patient. Although these conditions must be diagnosed and treated by a physician, ultimately, you can greatly improve the patient's chances of survival by taking some simple actions until more highly trained EMS personnel arrive on scene to assist you. Now let's go through some review questions. Here's review question number 1. The signs and symptoms of a stroke include all of the following except A, numbness or paralysis, B, high fever, C, drooling, or D, unequal pupil size. If you think about what a stroke actually is and where it occurs in the body, you should get this answer fairly easily. And the answer is B, high fever. Strokes affect the brain. So the least likely thing out of all of the other signs and symptoms that you'll see is for them to have a fever. Here is review question 2. Which of the following actions would not be appropriate when managing a patient who is suffering a heart attack? A, place the patient in the most comfortable position. B, administer oxygen if it is available. C, be prepared to administer CPR. Or D, move the patient as quickly as possible to ambulance for transport. Just think about what occurs in a patient who's having a heart attack and what the result of that heart attack can be, and you should easily get the answer. And the answer is, of course, D. It is not the step you should take to move them as quickly as possible to an ambulance for transport. If they're having a heart attack, they're possibly going to need CPR, they're going to need oxygen, etc. Those should be your highest considerations and priorities. And here's review question number 3. Hypoglycemia occurs when a patient A, consumes too many high-fat foods, B, has enough insulin but not enough blood glucose, C, suffers severe dehydration, or D, has too much blood glucose and not enough insulin. So in medical terminology, hypo means too little and hyper means too much. Knowing that, you should easily get the correct answer. And the correct answer is B. They have enough insulin, but because they're hypoglycemic, they don't have enough blood glucose or blood sugar. Okay, class, that wraps up Chapter 10. I always thank you for your attention and also encourage you to always make sure that you contact your instructor if you have any questions or you need your instructor to clear something up for you. Make sure to read and study your text carefully, and there were some important diagrams and tables that we covered in this chapter in this slide presentation, and you need to become extremely familiar with those and completely competent in terms of the information that they contain. Thank you again for your time, and we will meet again for Chapter 11.